Dr. Rishad Saab, distinguished guests, members of the academia, media, civil society organizations, development partners, Assalamu alaikum. Dr. Rishad has put a lot of burden on my shoulders. Sir, I will try whatever is best possible within the scope of my mandate. It is a great honor for me to address this August gathering arranged for a national cause. I would like to appreciate Dawn Group for taking the lead and all partner organizations for supporting this event to discuss perhaps the most critical issue of the country, that is population. The last 2 days' discussion and deliberations have helped crystallize common understanding of the issues, and there are several issues. Some of them have been highlighted by Dr. Ishrat. I am sure there is agreement that population stabilization is central to Pakistan's economic growth, social development, and future prosperity. I thank all development partners, organizations, speakers, panelists, and participants for their valuable contributions during these 2 days. And as Dr. Ishrat Saab has also advised, we would also look forward to follow up on these deliberations and hope that these deliberations would help further refine our strategies and policies. Ladies and gentlemen, you know very well the global population has surged from 1.6 billion in 1900 to over 8 billion in just over a century. This is a trend which is mirrored dramatically within our borders. Pakistan's population, which was around 34 million at the time of independence, has now increased to more than 257 million. This rapid expansion places immense strain on our resources. With the highest fertility rate in the region at 3.6, we are at close to 6.8 million people annually, which is close to the population of New Zealand, Bulgaria, or Gujranwala district. This gives you the scale of the challenge that we face in terms of resource allocation. Pakistan today stands at a critical and challenging demographic juncture. Our population continues to grow at 2.55% annually, outpacing our ability to expand essential services and sustainable resources. This imbalance is affecting every aspect of national development: our education system, our food security, water security, employment opportunities, urban planning, and most critically, our health sector, which is under severe stress. This is not a sustainable situation and requires coordinated response and swift and effective response. Within the population sector, then there are profound equity challenges that create stark disparities in access to information and services, disproportionately impacting the most vulnerable, which obviously affect women in particular. And women with low levels of education in rural areas often lack the autonomy to make decisions about their reproductive health due to deeply entrenched societal and gender norms. Furthermore, access to family planning and reproductive health care is heavily stratified by geography and socioeconomic status, with poor residents of remote regions and urban slum dwellers consistently facing lack of available facilities, trained female staff, in addition to inconsistent supply of contraceptives, even where demand exists. This inequity not only violates fundamental rights, it also perpetuates a cycle of poverty and high fertility, as those with the least resources are systematically denied the tools to plan their families and futures. Ladies and gentlemen, population is not only a challenge, it is also a tremendous opportunity as well, if managed wisely, as has been discussed earlier. The goal is to align demographic trends with our economic capacity, social priorities, economic sustainability. Achieving population balance or tawazun is essential for Pakistan's long-term stability, prosperity, and resilience. The subject of population has seen many changes, as Rishad Saab also pointed out, not just with the constitutional amendment, but also with the changing mandates of different ministries at the federal level. Lack of consistency has been a hallmark of this subject. For better coordination, Ministry of National Health, Resources and Coordination developed National Action Plan for 2019 to 24 through a consultative process involving national and provincial stakeholders. However, the National Action Plan, as most of you already are aware, the performance was lackluster, essentially due to lack of funding, COVID, inconsistent supply of contraceptives, supply disruptions, apart from the major challenge of coordination among stakeholders, which is national and provincial stakeholders. I'm happy to inform that this August House that this Ministry of National Health Services has been working to address these issues in the revised National Action Plan for 25-30. This action plan has been developed over several months and in consultation with national and provincial stakeholders. I'll not talk too much about the National Action Plan because this is yet to be approved by the Federal Task Force. But in addition to this action plan, there's some recent strategic developments which I would like to highlight. Since the government merged the subject of population with health, the population is integrated across the health sector policies and programs. This is formalized in the forthcoming National Health and Population Policy as well. The Federal Task Force on Population has been dormant for some time now. The Prime Minister has been requested to now chair a special meeting of the task force so that we can reinvigorate the process and we can restart the process of coordination at the highest level and the allocation of resources for this important area. Thirdly, due to efforts of several people and organizations to promote contraceptive use, Prime Minister has recently given a directive for exemption of sales tax on contraceptives, which is 18%. We are pursuing implementation of this directive because we are aware there is a large unmet need of contraceptives as well. Finally, Prime Minister has constituted a high-level committee under the leadership of Minister of Planning, which comprises experts. You've learnt about them from Musharraf Zaidi a while ago. Important area. Despite these recent developments, the most important challenge is the provision of integrated essential package of health services with the ability of essential medicines and contraceptives to the population, with least financial burden on the people. According to recent estimates, only 54.7% of the population is covered for essential health and population services in 2024, against a target of more than 80%. So 30% gap. Excellencies, this ministry has been working on developing a national health and population policy 26 to 35. The policy aims to address the issue of fragmentation highlighted earlier and provide a practical, evidence-based and action-oriented roadmap to realize a new vision. Population is a cross-cutting issue across the 11 priority areas in the National Health and Population Policy and a priority area for next 10 years. The new policy will commit not only to enhance uptake and ensure universal access to family planning services, adopt gender-responsive workforce policies, and building partnerships with the private sector. The new policy will chart a clear path towards a healthier, more empowered and resilient population, reflecting our national commitment to demographic resilience, gender equality, and social justice. We should also learn from successful family planning models of other countries, including Bangladesh, Indonesia, Iran, and Turkey. In Pakistan, we have successfully implemented the Lady Health Workers Program, which Dr. Ishar talked about. There is a need to ensure and revitalize integrated health and family planning services at the doorstep of community through a similar or the same program or similar initiative. We also need to leverage available platforms internationally like the SDGs, PPD, Family Planning 2030, and others for guidance and for delivery of services. In summary, population management is the national priority requiring coordinated federal and provincial actions. We should focus on operationalizing the coordination mechanisms, ensuring enhanced financing for integrated family planning and health services, and fostering joint planning and monitoring. On behalf of the ministry, I assure all the participants that all action points of the declaration of this summit will be incorporated in the revised National Action Plan on Population 2530. Provinces and regions will be engaged to ensure ownership and nationwide alignment. In the end, I would like to thank DawnMedia, international development partners, especially Foreign and Commonwealth Development Office, Population Council, especially Dr. Zeba Sitar, and each of the participants who have contributed to this national dialogue and helped make Pakistan Population Summit 2025 a success. Together, we can ensure a stable, prosperous, and sustainable future to the people of Pakistan. Thank you very much.